Yeah, and that's the one thing about this class. So I'm glad you mentioned this because it's a good time to bring this up. Throughout this class, we are going to teach you, I am going to teach you, I can't speak for everybody, I can only talk about Chris Camp. I am going to teach you national standards, what is expected for National Registry. Now that said, that doesn't mean when you leave this class and you go to your respective companies, depending on where you work, you might be allowed to do more things or less things. It does come down to protocols, and protocols are different all over the place as far as who uses what protocols. Now, protocols for the state of Tennessee is standard across the board, but what I'm getting at is not every service uses all the protocols available to them. Some will exclude some things, some will include some things. So you have to know what your protocols state. So when you go out to company, they may allow you to do a different type of procedure that we couldn't teach you here because it is not on the National Registry standard. Because I have to teach you what's going to be tested on. It would do you a disservice. Just remember this is a foundation. And after this, you're going to start to build blocks on that, and that comes out in the field. Same thing with paramedic school. It's a foundation to what you're going to do as a paramedic. When you get out in the field, you grow that foundation. But if you don't have a good foundation, just like any house or building, it's going to fall apart. So this hopefully is a good foundation. All right, we're ready to go? Tag team back again. All right, so let's talk about this. 12 leads. You do not have to interpret the rhythm as I was talking about, but you will be expected to place 12 leads on patients, especially in the hospital. In the hospital, it's going to be a lot of what you do. As they triage people, bring them in, they're going to be asking you guys to put the 12 leads on. Now, what they use in hospitals are these little bitty stickers, little tabs. You can just stick them on there, and then these clips, and you clip them on. It's pretty easy. In the back of the ambulance, we have little round stickies. You have to stick those on the patients. And what's important to note is where these things go. I'm going to give you the shortcut memorization tools that I was taught. If you have heard something different but it works for you, that's fine, okay? I'll answer the other question. No, it does not matter what order you put them on, so long as they are placed in the right places. Because in other words, so if you do left first and then around, or right first and then around, it doesn't matter as long as it's in the right place. How I do it is always start with the white one, white to the right. Also even has on there, right arm. It's fireman proof. You don't understand what that means? Oh, you do?
It means the firefighters don't.
Even a firefighter can do this. I'm joking on firefighters. I'm a firefighter. It's cool. All right, so right arm. What is that? When you hear right arm, that means what?
Patient's right arm.
Right arm, exactly. The patient's right arm. So if you're facing the patient, this is your right arm, but that's their left arm. So you have to make sure it's the patient's right arm. Yes, these are limb leads, so they can go on the arms and the legs, but it's better if you can place it on the torso. Why do you think it would be better if you can keep these on the torso?
Less interference.
Less interference, less movement, right? Arms and legs move a lot, causes a lot of squiggle, a lot of artifact is what that's called. If you can keep it in the chest, torso area, a lot of times it's going to cut down on that. So even with this mannequin, we have the spot right up here on the top shoulder. So that is considered the right arm, but you could use the whole right arm. This is just where we usually like to go with it. Now, what happens if you have a patient that's got one of those fur chest? Looks like a sweater. You're going to have, well, you might not make friends with that. You should have a razor in your unit. You just shave just a little small spot, big enough to place the sticks on, the little stickies. Now, if the person's super sweaty, how can you get that to stick?
You can dry them off.
Yeah, but guess what? It depends on what's going on, what's causing the sweating. It could just bead right back up. Little trick of the trade, take an alcohol swab, swab it real good, then dry it off with a 2x2. That alcohol will help evaporate that moisture for a long enough period of time that you can put that sticky on there. Now I'm going to tell you, when you do that, it's going to stick. So if you don't get all the hair out of the area, it will be a whoosh when you're done, because it's going to stick. All right, left arm, LA. So white to the right, white to the patient's right, white to the right. Smoke. What's underneath smoke? Fire. Just like a fireman. It's amazing. Smoke. Fire. I can never do this when I'm on the side of it. I literally have to come around here and the skin is all jacked up. There it is. So, white to the right, smoke over fire. So you got your left arm. This is the left leg. Yes, it could go on the leg. Always try to place it down here at the base of the ribs. And then the green one just goes across from that. Some people know this as salt, pepper, ketchup. clouds over grass. I don't care how you learn it. Just know it's white, the black, the red, and the green. It's called a 4-lead, right? Now, once you do that, you got to put your 12 lead on. If you're in the back of an ambulance, you're going to have to attach this little piece. If you're in the hospital, it all comes all together. These wires do get in the way at times. They will be challenging to not get them all tangled up. V1, 2, 3, 4, 5, and 6. So V1 through V6, they're all labeled. I do not know the colors of these because it doesn't matter. You're only going off the V's. So you look for the V1 and the V2, right? Remember, you're always going from the patient's right to left. The heart's on the left side. So I got to find the V1. Here we go, V1. On this mannequin, it is a little low, and this chest shield is a little jacked. If the patient's skin is sloughing off, there are probably bigger things at play. Hopefully that's not the case. V2, where are you at? V2. So I literally do this too in the field. I have to look for the V's. So V1 and V2 go on either side of the sternum. On this thing, you see it's kind of low. It goes a little higher than what this is showing. So V1 on the right side, V2 on the left side of the patient's sternum, in line of one another. Once you put those in place, I go to V3. This is an easy landmark. Everybody has a clavicle. You go mid-clavicular. So you look at their clavicle, and you're going to go straight down. And when you go straight down, it should be just to the left of V2, about a ½ inch down. So you're just going to go straight over and down to the V3. Now you're mid-clavicular, boom. The next one I put on is V6. The reason I jumped to V6 is because it's mid-axillary. So that's going to be the same landmark for everybody. On the left-hand side of the patient, you're going to go down to you're going to go across to the mid-clavicular area. This stupid thing here. It's supposed to be right there, but it's covered up by the skin that is off, and his head's falling off. So this is great demonstration. This is real. This happens in the real world. Heads come off. Not really. So the V6 connects right here. The patient's mid-axillary. So now you got mid-clavicular the V3, V6. The V6 should be right around the center of the torso, on the ribs. Then over here at the V3, you're going to go down and over slightly. And then V5 goes down and over slightly. You're making like a boom. I know that guy's going to fall. You're making like a smiley face. So to keep this in perspective, V1, 2, V3, V6, 4, 5. Going straight around the chest. Now, it says that it's a 12 lead, but there's only 10 wires. Why is it called a 12 lead? Go ahead, throw a guess out. It doesn't matter if you're really, really wrong.
You're getting a pulse as well or something?
You will get a pulse, but that's not why.
What happens to the leads and the legs? After leads, they go to the legs.
Well, that's the limb leads, but that's all part of the 10. Ultimately, it's called a 12 lead because it takes 12 different angles, pictures of your heart. So even though you got 10 stickers, 10 little pokey things you put on, it's going to take 12 different angles. And that's going to give the paramedic a lot of information on if there's a problem and where the problem might be with the patient's heart. So practice with this stuff. Come up here. You don't have to understand everything. You just have to. You need to know correct placement. And this is. We're going to try to fix this little sleeve here. You just brought in another torso.
Yes.
That might be even better to practice with. Just putting the tags on there. Yep.
I'll get some more tail.
Okay. Good. So are there any questions on this? Yes.
I've seen guys in the field. I know you said it's better to do the torso on up. But I've seen guys in the field put the RE on the wrist
And that's acceptable. You can do that.
legs.
Yep. Those are limb leads, and you can do that again. But what's the concern by putting it on the limbs?
They move.
If they move, it's going to give this a poor image. Now, you're not wrong for doing it, and sometimes it's easier to do that depending on what is going on with the patient. But just know that if you can get it on the torso, it's better for as far as keeping artifact down. But if you have to go to the, that's fine. They're that. Now, one other thing to talk about is, so this is usually a question. Look, we're all professionals. You got to put these on everybody, right? So females, how do you go about placing these in this area? The correct way to do that, dude's head's gonna fall, is you just take the back of your hand. Of course, you're gonna explain what you're doing to the patient before you do it, and even ask their permission. And then you're just gonna gently raise with the back of your hand their breast and then put the leads in their respective places. That's what you do. This is not, and look, here's the thing. Here's what I tell everybody. If you make it feel awkward, it will be awkward. But most people don't go into it feeling awkward because you're a medical professional. So that's why I tell everybody, when this is your first time doing 12 leads, it's a normal thing. It's part of being a medical person. So just go about your business, do your thing, put the stuff on, and get you a good printout. Because that could be the difference in somebody having a good diagnosis and a poor diagnosis. Yeah.
In regards to the females, like with your I have underwire bras, will that wire interfere with the lead?
No, not with the leads.
Okay.
If you're defibrillating, yes, you need to take that off. Yeah, but for the leads, no. Unless you put it on the wire, that's a different story. That would be a poor reading.
Yeah.
X-rays, it would be a problem. Yeah. No other questions? Okay, cool.